be prepared to be off mute and respond to those roll call votes. And with that, we'll start with one roll call on attendance. If I can ask Marcin, please call the roll and confirm that we do have a quorum.
Yes, Mr. Chair. Claudio Gualtieri, Chair.
Here.
Thank you. Matthew Brockman. Thomas McNeil.
Here.
Thank you. Peter Hadler, Deputy Commissioner, Department of Social Services.
Here.
Thank you. And Commissioner Manisha Tutani from DPH. Commissioner Tutani, I think you're muted. Nevertheless, we do have a quorum at this point, Mr. Chair, with 3 voting members present.
Thank you. This is Claudio again, and at this point, I would ask that the Access Health CT senior leadership staff introduce themselves. James, do you like to start?
My apologies. Good afternoon, all. James Michelle, Access Health Connecticut.
Good afternoon. Holly Zwick, Director of Finance, Access Health Connecticut.
Good afternoon.
Oh, sorry, Susan, go ahead.
Oh, sorry. Access Health, Director of Legal and Governmental Affairs.
Good afternoon, everyone. My apologies for stepping on Susan's introduction. This is Glenn Jurgen, Director of Human Resources, Access Health CT.
I think that concludes the introductions. This is Claudio again, and that brings us to the next agenda item, which is public comment. We are not in receipt of any written public comment. I'm just going to pause to confirm from Marcin to make sure that that is the case. I did not see any come in, but wanted to confirm that to be true.
That is the case, Mr. Chair. We did not receive any public comments.
Okay, great. Thank you. Then this brings us to agenda item C, which is review and approval of the minutes from our last meeting, which was April 11th, 2024. The meeting minutes were submitted in advance of this meeting. I hope folks had a chance to review the draft minutes. I'll entertain a motion to approve such minutes.
So moved.
McNeil.
Deputy Commissioner Hadler moved, and Tom, do I have you for a second?
Yes, you do.
Thank you. All right. Any comments, edits, clarifications, or discussion on the minutes, the draft minutes? Seeing none, we'll order a roll call vote on approval.
Claudio Gualtieri.
Yes.
Matthew Brockman. Thomas McNeil.
Yes.
Peter Hadler.
Yes.
And Manisha Tutani.
Yes.
Thank you. Motion
Excellent.
passes.
Thank you. We're moving on now to our FY 2024 year-end budget report. And for that, I'm going to turn to Holly, our Director of Finance, to present on the report. Holly?
Great. Thank you. Holly Zwick, Director of Finance, Access Health CT. Good afternoon, and thank you, Chairman Gualtieri and members of the Finance. Today, I will be speaking about the fiscal year 24 budget report, the fiscal year 25 Q1 budget, and the proposed reserve policy. Next slide, please. Thank you. This slide portrays the fiscal year 24 budget versus actual summary. Access Health closed fiscal year 24 approximately $166,000 under budget. Our shared budget with DSS for fiscal year 24 closed at just about $2.3 million over budget, and I'll go into more detail on the next slide. In more detail, we finished the last fiscal year 24 over budget on the revenue side due to increased interest rates over the past 12 months and assessment revenue higher than projected, due in part to dental assessment amendments. On the expense side, we closed fiscal year 24 approximately $166,000, as mentioned previously, under budget overall. Temporary staffing came in over budget for fiscal year 24 by a little over $243,000 to pay for assistance with network support and IRS CMS changes to compliance requirements. Our largest variance in savings on the expense side can be seen in the contractual line item, which came in close to $622,000 under budget due to a lower call volume proportion of QHP versus Medicaid calls. This was due to Medicaid unwind. Equipment and maintenance also came in under budget by roughly $462,000 due to savings on system maintenance. Our largest over budget variance can be seen in the IT enhancements, which closed fiscal year 24 roughly $778,000 over budget. This was for additional IT system enhancement projects involving regulatory changes, along with updates to better our system. For example, enhancing broker capabilities to manage their client lists and more, such as the DRS Check the Box initiative. Our shared budget with DSS for fiscal year 24 closed at approximately $2.3 million over budget, as stated earlier. Next slide, please. This slide shows carry forward projects from fiscal year 24 to fiscal year 25. These projects were initiated and funded in 24, but not completed by the end of that fiscal year. And this table depicts a breakout of the projects. All of these projects will be completed in fiscal year 25 on time and on budget. Are there any questions up to this point? Okay. This slide brings us to the investment report, which we need to revisit every 6 months. To briefly recap, the objective for Access Health CT's exchange funds is to obtain the maximum rate of return while preserving the principal and providing immediate liquidity. Access Health invests in the State of Connecticut Treasurer's Short-Term Investment Fund, or STIF. This account is available for use by the state's funds and agencies, and state statutes authorize these pooled investment funds to be invested in U.S. government and agency obligations. These investment pools are under the control of the state treasurer. Next slide, please. The year-to-date earnings as of September 30th, 2024 on the STIF account is $335,595. That is an average of over $110,000 monthly for the last 3 months. Interest rates are on a decline, however, and depending on what the Feds do, we must anticipate revenue on the interest in the STIF account may very well decline moving forward. It's important to note that Access Health CT's investment portfolio is in compliance with our investment policy, and we can meet our expenditure requirements for the next 9 months. Next slide, please. The fiscal year 25 Q1 budget is focused on investments in IT, cybersecurity, and health disparities to aid in supporting our mission of decreasing the number of uninsured residents, improving the quality of healthcare, and reducing health disparities. Next slide, please. Here you can see the fiscal year 25 Q1 budget. The fiscal year 25 year-to-date budget versus actual summary. Our Access Health budget is $546,940 over budget at the end of the first quarter of fiscal year 25 due to the timing of projects, as we occasionally have the opportunity to start projects early. The DSS shared cost budget at the end of Q1 is roughly $382,000 under budget, also due to the timing of expenses and projects. Next slide, please. This slide portrays the fiscal year 25 budget versus actuals for Q1 in more detail. As I mentioned previously, interest income is approximately $119,000 over budget. Market assessments are also over budget by roughly $24,500 due to dental amendments. On the expense side, the multiple variances are due to the timing of projects and invoicing, including IT enhancements and equipment and maintenance. Some of the projects we started in Q1 are moving faster than anticipated, and we have needed to spend money earlier. At this point, we are not anticipating any changes to the current proposed budget as of the first quarter of fiscal year 25. Next slide, please. Thanks, Marcine. This slide shows the breakdown of the full fiscal year 25 budget after quarter one. Once again, we are not anticipating any changes to this budget, but if any changes become necessary, we will come back to the board and finance committee to approve any changes and/or spending amounts. Next slide, please. In addition, we are not anticipating any changes to the shared cost budget with DSS currently. Next slide, please. I'd like to speak briefly about our reserve policy at this time. Our fiscal year 25 year-end reserve balance is projected at $18.5 million, which based on the fiscal year 25 budget would cover 6 months of operating funding. Based on experience, investment in performance and savings achieved throughout the year, along with the potential for higher billing for assessments, all point to an anticipated surplus between $500,000 and $1 million conservatively at the end of fiscal year 25, but it is just too early in the fiscal year to tell. Next slide, please. Okay.
Ms. Claudia, thanks, Holly. I think before we jump into votes, I just want to pause and see if members have any questions. I know you went through 3 different tranches there. You did the FY24 year-end budget report. Then we saw the Q1 investment report, fiscal year 24 and the fiscal year 25 Q1, and then our budget reserve. So I'll pause and see if any members of the committee wish to ask questions or have any feedback. All right, seeing none, Marcine, I think that then we would take the first vote, which is for the FY25 quarter one budget report as presented by the exchange staff, as by Holly just now. Let's take that vote first. Do I have a motion?
Tom McNeil, so moved.
Thank you, Tom. Seconded by DC Hadler. Any comments, discussion? If not, we'll take a roll.
Okay. Claudia Gualtieri,
Yes?
Matthew Brackman,
Yes.
Thomas McNeil,
Yes.
Peter Hadler,
Yes.
and Manish Zutani.
Yes.
Thank you. Motion passes.
Great, thank you. I believe, and keep me honest here, I believe our next is on the proposed reserve policies. We're going to have a discussion and then a vote on that.
Yes, wonderful.
Holly, do you want to? Yeah, thank you.
Yes, thank you. Holly Swick, Director of Finance, Access Health CT. I would like to take a brief moment to walk you through the evolution of the reserve policy here at Access Health. Back in April of 23, so we don't have to go back too far here, the Access Health Board suggested that we formalize a reserve policy. And in that June, we presented research on the reserves of other state-based exchanges and quasi-public agencies. We found that 3 other exchanges had between 6 and 15 months of unrestricted reserves, while one quasi-public agency had a reserve of 25 months. Then last November, we presented the Finance Committee with additional research, including data on the reserves of Connecticut nonprofits. And finally, this past April, we presented to the committee a draft reserve fund policy based on our research. The proposed reserve fund policy would determine the target reserve amount as well as the intended use of the reserves. We have taken your suggestions from the April meeting and added that we would revisit the target amount of the reserves at least every 3 years. To review the other major points set forth in the proposed reserve policy, the designated funds are set aside by the board. We would like to target 9 months of operating funds, which would equate to approximately $27.8 million for fiscal year 25. The funds are to be used when there is an unanticipated loss of funding for one-time unbudgeted expenses, whether an emergency or for the implementation of strategic initiatives, and for sudden increases in expenses. A request to utilize reserve funds would be approved by the Access Health Finance Committee and Board of Directors. Finally, we also spelled out how the calculation for the reserves is based on the fiscal year budget and not the calendar year. Were there any questions on the proposed reserve policy?
This is Claudio. Holly, thank you for recapping that. Just to add a few more and sort of summarize where we came to and why we landed here.
Yes,
I know
please.
there was a lot of discussion by the board and interest around cybersecurity as being a threat and wanting to make sure that the exchange could sustain any temporary short-term but potentially debilitating loss as a result of a cyber attack. And so that's part of the conversation here. And I know we also crosswalked this with our insurance plans that are currently in place and made sure that the reserve fund was necessary and sufficient to wrap around what our insurance would be for that. I think also, as you mentioned, this allows the board to sustain if there's these one-time expenditures. We don't know. Sometimes there's federal mandates. Sometimes there's systems upgrades that create an amazing business opportunity. Covered Connecticut comes to mind a few years ago when we first initiated that program and needed to tap in to quickly and nimbly take advantage of that opportunity. So I think that the due diligence that you all did and the commitment to, on a periodic basis, to look at benchmarking to nonprofits, to quasi-publics, both in the state and other exchanges across the country is a good basis and provides us some assurances that this is a well thought out. So I would recommend approval by the committee. Any other questions? Oh, go ahead. Sorry, Holly.
Oh, that's okay. I just wanted to thank you for adding those points. They're all excellent. Thank you.
So the policy, if I understand, is going from 6 months to 9 months.
No, Tom, this is
I would
the first.
add that in effect, we don't even have a formal policy. So
Right, we
what
don't
this
have-
is,
right,
does is very good because it formalizes what is a target. So that if we reach
Mhm.
that one point, we don't need to sort of build up extra reserves. We can start looking at, even potentially decreasing the assessment if need be, because we've already reached that reserve. So I think you're right, Tom. Historically, that 6 month has been where we landed, and you saw that that's where we're at now. I think what this does is the board had wanted some clear metrics of why are we keeping and what are we keeping it for and what's the right amount. And so that's why I liked this idea of just a formal policy.
I got you.
James, I didn't mean to cut you off. If you want to add anything.
No, simply you said that basically, currently we don't have a formal policy. This formalizes the policy, puts some structure on it and some rules and regulations for us to follow with the board's approval with respect to expending reserve funding.
This is Claudio again. Any further questions, comments?
Claudio, this is Manisha.
Commissioner
Just a
Giussani.
question. Yeah, sorry. I thought you said the target was 6 months, but the slide says 9 months. Did I misunderstand?
No,
The
the
target
thank
is
you.
9
The
months.
9 months is the recommended for formalizing the policy. What we currently have is roughly 6 months.
Okay, I understand. Thank you.
And again, to reiterate what Holly said, any use of the reserves that we build up obviously would come for a vote for the finance committee, all of us here, and then the full board.
Mhm.
Seeing
Just a
no
question.
further, yes, of
Just
course,
one
Tom.
question.
Go ahead.
What is the anticipated time frame from us getting from an actual reserve of 6 months to a target reserve of 9 months?
So Tom, we're going to look to do this. We're going to look to do this over the next 3 to 6 years. Again, this will come from grants. We are applying for grants to support our operations, and to the extent that we get those grants, and some of those grants, sometimes you could use some of your overhead you could charge some of your overhead against the grants, and if it's work that we are currently doing, and we're able to get a grant to support it. So it's the entire proceeds of grants will go into reserves.
Mhm.
Other part of it also savings. savings and also the excess revenues that we may collect from investment returns as well as assessments. We think that given the volume of the individual marketplace, mainly because of Cover Connecticut and the HIT subsidies, we think that in the coming years, the assessment revenues will be higher than we had originally anticipated. We just hope that our costs do not keep up with the additional revenues, so that the excess revenues could go into reserves.
I got you. Thank you.
Yes.
Any further questions? All right, we're good to vote then. So this is for approval of the reserve policy and a recommendation to the full board to approve. Marson?
Claudio Gualtieri?
Yes.
I'm sorry, is there a motion? There has to be a motion. My apologies.
So
Tom
moved, Mayor
McNeil,
Brockman.
Tom McNeil seconded.
Motion is properly moved and seconded. So any further discussion? What we had? Seeing none, now we'll order the roll call. Thank you.
Okay, thank you. Claudio Gualtieri, once again.
Yes.
Thank you. Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Peter Hadler,
Yes.
and Manish Jutani.
Yes.
Thank you. Motion passes.
All right, this is Claudio for our last item, which is a motion to adjourn. Another efficient day of the finance board meeting under 30 minutes. Do I have a motion?
Tom
So
McNeil,
moved.
so moved.
DC Hadler moved, Tom McNeil seconded.
Second,
Roll
yeah.
call. All those in favor?
You still have to do a roll call, Mr. Chair.
Yeah, we'll do. Okay, we'll do a roll call. I jumped the gun. I'm really excited.
He's so desperate to end the meeting quickly under the half hour. Stretch this out, person.
I want to beat my audit time.
Claudio Gualtieri,
Yes.
Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Peter Hadler,
Yes.
and Manish Jutani.
Yes.
Thank you, Commissioner Jutani. Motion passes.
Thank you. We're adjourned. Have a good
Thank you all
afternoon,
very
everyone.
much. Thank you all.
Take care.
Thank you.
Yeah.
Thank you for your time. Have a great afternoon.